I retired about 7 years ago after 48 years in nursing, both civilian and army.
Okay.
And one of the best parts of my time professionally was in 2003. I worked as a registered nurse in a level 1 trauma centre in North Carolina.
Okay.
In a place called Greenville.
Right.
And they can run a hospital. When I left the hospital I was working with to work in the States, I was working in a particular room. It was the isolation room. There was a bit of mould on the ceiling tile.
Right.
The lino was cracked and the paint was peeling. I came back 3 years later and nothing had changed.
Wow. And was it a particularly old hospital?
No, it was. It was called Plymouth General, but
Okay.
but having said that, where I worked in the States, everything was stripped and cleaned in intensive care. Every month, they took a room out of circulation, they cleaned the floor, they repainted and everything. But the point was that all the staff there, the measure that we had was patient satisfaction, because if the patients aren't satisfied, they don't bring in the money. And
Right.
if they don't bring in the money, your raison d'etre is gone.
Yes.
And the staff used to get a bonus, and that was purely on the patient's sort of feedback. And it started at the top. And when you look at the NHS, you see these managers on salaries twice that of the Prime Minister,
Yeah.
and they do the most awful things, and they walk away from it, and then you see them on the circuit popping up somewhere else. My wife was working as a PA to one of the vice presidents, and she came home and she said, "You'll never believe it." She said, "The chief exec just sacked the director of finance."
Right.
And apparently this guy had had 2 warnings that, the budget was not doing as it should. And I saw the chief exec go in his office, shake his head, and he left the building. The new director had already been headhunted. He came in the afternoon. He put an email out to all his staff saying there will be a meeting for all staff after work at 5 o'clock. Anybody not present will be deemed to have terminated their contract. And it was so nice to do healthcare where people were working, supporting the people on the front line. Doctors, nurses, you needed equipment,
Yes.
you got equipment.
And I bet you didn't run out of anything either.
No, we had the equivalent of Kanban. And when I used to go to work, 6:30 in the morning,
Yeah.
the big trucks would roll in and you'd see them, and that was what we had for the next 48 hours.
And what do you think could be done to make the NHS run like that? Is it just too top-heavy, do you think?
Well, it's interesting. Just before I retired, I was a union rep. And this hospital in Plymouth, we had 5,200 staff. 25% of them were admin and clerical and management.
Yeah.
And that's ridiculous.
It is. And why do they need all those people?
Well, I don't know. You see, in America, that basically the only thing hospitals are accountable for is the federal budget. That's if you're you're providing Medicare and Medicaid and you're providing trauma services, which we were.
Right.
That carries federal funding. And the thing is that the administrators there, all they're concerned about is their own organisation and meeting the federal requirements for providing emergency and Medicare and Medicaid. Here, half the people in management and that are submitting returns to the administration, to the government.
Yeah.
And you've got people bogged down with paperwork, which is an administration. And basically, if we streamlined our management, we don't need 25% of our resources directed towards admin and clerical. And I would imagine if you look at the establishment returns of most major hospital organizations, you will find that the biggest proportion of staffing and the financial allocation goes towards management and admin and clerical.
Yeah. No, I think you're absolutely right. John, what a great call. Thank you so much. John, with experience not only of this healthcare system, but also one of them in the United States of America, in North Carolina, a place I know quite well as well. Let's talk to Sarah, who's a former nurse as well. Sarah, very good morning to you.
Hello, good morning.
Good morning.
I rang up because I qualified in early 2000 and worked till 2013 in central London. And I actually was working mainly under a Labour government.
Okay.
And then, of course, the Conservatives got in after the crash, etc.
Yeah.
And I felt that the cuts under Labour were just as bad, in fact, worse during the period I was working. The staff shortages were acute for a variety of reasons to do with the cost of PFI contracts sometimes and other reasons. And the real central problem is the micromanagement of the NHS, and I did agree with your last caller about the need to support frontline staff, because frontline staff actually do run it.
Yes, and they should. I mean, they should run it. We should be making medical decisions based upon medical advice, not financial advice.
And one of the most stressful situations that people are in, especially as a nurse, because, to be frank, doctors aren't always that easy to work with, is a huge amount of responsibility without power. And that's a massive problem, especially when you add the micromanagement of people who really don't know what they're talking about. In terms of private hospitals, which I've worked in as well, I think all medicine is more or less international.
Yeah.
The staff shortages are more or less international as well. And in private hospitals, they want to make money, and in the NHS, they want to save it.
Yeah.
In other words, money is a key issue in both. How it works with privatised services varies, because some of them are good and some of them are not.
Sure.
And it would depend very much. I mean, take care homes, for example, all the disasters that have come from them. It depends very much on the contracts these people are given.
Yes, and unfortunately, again, the public sector gives out contracts to people which they would never get in a month of Sundays from a private organisation. Sarah, another great call. Thank you very much indeed. Vicky is in Brighton. Hi, Vicky.
Hello, Mike. Good morning to you.
Good morning.
Just a quick comment to make and a suggestion. All this individual trust buying of product is absolutely ridiculous. I'm talking about basic stuff, nothing to do with medical. And my example is take loo rolls.
Right.
Okay? All these trusts buy loo rolls, and I understand the individual price for 6 loo rolls varies enormously. Why on earth isn't it bought centrally? You do a contract with, say, Tesco or Asda or one of the big supermarket chains. They have warehousing, they have distribution all over the country, 3 or 4 times a week. All the major supermarkets, cities, towns, whatever, they deliver. And the unit cost would absolutely plummet.
Yes.
An individual trust, and there's loads of basic stuff like that, tissues, whatever. I think Corbyn would like us to build state kind of loo roll factories.
Oh, he would, and employ loads of people from Islington and Hackney to work in them, as commissars of the toilet roll department.
Exactly. But, I mean, if you've got the supermarkets there, they buy in enormous bulk themselves for selling in their own outlets.
And why on earth does the government pay more for stuff than we do? They should be paying a lot less.
It's ridiculous. It's just crazy. And, of course, at the same time, you'd have the joy of getting rid of a lot of these admin staff in these trusts whose probably, whole raison d'etre in life is to buy loo rolls and toilet, and tissues.
Yeah.
It's just, and then you haven't got the whole kind of pension ethos you've got to worry about, because you're cutting down on the admin side.
Right.
And, in fact, using that money on the medical side.
I mean, listen, Vicky, I'm afraid I'm going to have to award you the common sense call of the day. There's so much of it out there that we can access. Why can the government not access any common sense? Why can the politicians not actually have any common sense? How is it possible to have 650 idiots in a palace of Westminster, none of whom have any common sense? What is going on?
I wanted to throw an idea about the NHS. My son's just recently qualified, actually, as an ODP, working in the operating theatres.
Okay.
And next year, he's off to New Zealand to canvass the area to see, what sort of better life you can get out there working in their health system.
Okay.
And I would just think, well, why can't we give them some sort of incentives to remain, retention? Because that seems to be a massive problem.
Right.
I know it'd be a bit radical, but why don't we just exempt these kind of people, what I call the emergency public services that we all rely on?
Yeah.
Not just the NHS, but the police, the armed forces, teachers, people we need and supposedly value. Right? Why can't we make them tax exempt?
That's a great idea. I love that idea.
Right? And not just that, but the Tories have done this. I can't remember if it was the Tories or the Labour government. They offset the cost of that by adding a couple of pence onto national insurance.
Yeah.
Right? Now, I'm a working man, but I value these services more than I value 2 or 3 pence on my national insurance contributions. Yes.
I would just add one wrinkle to it, Kevin, because I'm very happy to have the frontline people in medicine, in the ambulance service, in the fire service, in the police service. I'm very happy to have them tax exempt, but I'm not happy to have the pen pushers who are sitting behind desks being tax exempt, and that's where it starts to get tricky.
I agree totally. These would have tax exemption for people who are delivering the frontline services, not the administrators sat in the background. I'm on about real doctors, real nurses,
Yes.
teachers, police, firemen, etc. And the armed forces, because they've been pretty much shafted over the past
Well, I'd like to
few years
see
as
them
well.
getting a bit more money, to be honest, never mind getting taxed.
Well, they wouldn't have to find any extra money, would they? If they made them tax exempt, they don't have to find any extra money from anywhere.
Sure.
All right? But they could raise extra funds with a couple of extra pence on national insurance. I mean, I was even looking at it, 1% on a tax increase. For me personally, that would cost me £20 a month. Right?
Yeah.
But let's say on average there are 20 million taxpayers in the UK. I mean, that sort of money would generate revenues of in excess of £3 billion. Why not?
I think it's a great idea. Best idea I've had, and we've had a lot of great ideas today, Kevin. This one I love. I think it's terrific.